Today we're known as the discipline of occupational and environmental health, but we have a long and proud history. We started out with being a unit in the Department of Community Health when we were known as the University of Natal, and at that point we established two units. One was called the Industrial Health Unit that was based at the Department of Sociology here on the main campus, and these two units merged to form what was then known as the Center for Occupational and Environmental Health. In 2005, under the wisdom of the leadership of Prof. Barry Kisnasamy and the Director General for Health in the province, Prof. Green Thompson, we established the Department for Occupational and Environmental Health, which eventually became known as the Discipline for Occupational and Environmental Health. Our responsibilities over that period was to ensure that we trained doctors and health professionals to be able to respond to the needs of workers in the different working environments, to protect their health so that they could be as effective and work as long and lead healthy lives given the exposures that they faced in the workplace. We also then focused a lot on the research work and research into the work that the effects of health that these individuals may experience. And over the years, we've built a reputation both nationally and internationally about doing very good epidemiological work in the health of workers. In the recent times, we shifted our focus because of the needs of communities around the Durban area, looking at air pollution and the health effects that air pollution causes, particularly amongst children. In 2010, set up what was known as a birth cohort. We selected pregnant mothers and followed their children up, and we're still following those children who are now in the age of about 10 to 12 years of age, and looking at the effects that the air pollution is causing to their health. In the last 3 to 4 years, we've started to shift our focus to include the impacts of heat because of the crisis created through climate change, looking at the effects of heat and how this may affect the health of these young children, because we know that if their health is affected today, then over the years as they continue to be exposed, they're likely to have more severe health outcomes because of these problems, because of these exposures.
At the Discipline of Occupational and Environmental Health, we offer various services and academic activities. We have a registrar training program that serves to train qualified medical doctors in the field of occupational medicine. We get referrals from province and nationally and various stakeholders, including industries and trade unions. And our registrars train on clerking patients, assessing patients, diagnosing and investigating occupational medicine cases. We also offer research-driven activities, which is our MACE clinic, which is Mother and the Child in the Environment clinic. And at this clinic, we do pediatric assessments, which are a full clinical assessment, impulse oscillometry, pheno testing, and spirometry. We have consultancy work, which involves a lot of community engagement. If there are any incidents or events that happen in the area or within the province, we are asked to do assessments of the community involved and of the workers. In terms of academic activities, we are involved closely with the College of Medicine of South Africa, and we form part of the College of Public Health Medicine. As part of the college, we are involved directly with drafting curriculum and guidelines in terms of training of occupational medicine, and this has a direct impact on the occupational medicine training programs nationally and on future registrars. We also offer benefit exams to ex-miners as part of our services. And besides benefit exams, we also are involved a lot with compensation cases of mining communities and miners. So we do reading of x-rays within the department using ILO specifications, and we try to get impairment ratings for our miners, which forms a predominant part of what we do as occupational medicine specialists. And we try to provide as much services that we can to the communities and to the workers alike, so that we can assist workers and the communities in the KZN and nationally as well. As leaders in occupational medicine and environmental health, we aim to provide services to optimize community and worker health nationally and globally.
My name is Minentle Telezi. I am a PhD candidate and a research assistant in the Department of Occupational and Environmental Health. So I'm working with colleagues in investigating the associations between air pollution and the health impact. So we have seen from previous studies that air pollution has the greater impact on human health. So we are trying to come up with different interventions to assist the affected communities. So I'm also involved in the undergraduate teaching for medical students, where I teach air pollution and health. And I'm also facilitating the case studies for those students.
I think our department is quite a unique department. Certainly in the province, we provide the sort of leading expertise in the areas of occupational and environmental health. We provide a range of advisory services to a number of different stakeholders, including communities, government, as well as non-governmental organizations. We're represented on national and international structures, providing both policy and research initiatives in these areas.